Many have been asking me, how did you manage to ace your GP exams in one go? And I've also seen questions asking me, how difficult or how easy are the GP exams? So in this video, I'll be tackling that. I'll be talking about my personal experience on how I was able to ace my exams in one go. I'll be offering some tips of, I think 6 tips of what I have seen or what worked for me. And hopefully that should give you some pointers. And please sit tight and listen in. I must say my favorite of the tips is tip number 3, tip number 5, and tip number 6. So you have to sit back and listen in. So my name is Anna, and I'm a migrant doctor mom, and I want to sincerely thank them that are interacting with myself on this channel and for keeping the questions coming, because it's through this that I'm able to know what to cover next. So to you, my viewer, who asked me, how hard are the exams? That's a very difficult question for me to answer and type away, because there are various things and various aspects of the exam that you sort of need to understand. And I must say, there are people that pass it in one go and there are people that do not. So that to me tells me that it's not an easy exam, but it is an exam that's doable, but you need to prepare well for it. So my tip number 1 on how I was able to ace my exams, and just a disclaimer, everything that I cover in this topic is my personal experience. It may be different for another person, but for me, this is what was able to see me through my exams in the first go, and I must say with very good outcomes and results as well. So it may be helpful to you, and someone else that has used a different has different tips. By all means, comment down there so that we can help people that are in the middle of sitting exams or people that are planning to sit their exams. So passing the GP exam is possible, but you just need to prepare really well for it. So my tip number 1 is essentially you need to understand the structure of the exam. Having studied overseas, having done my exams overseas, I understand, and I feel like the exam structure is something that you definitely need to understand, because you need to know how to run an experiment to get the result that is expected of you. So understanding the structure of the exam is the biggest thing for me, understanding the various types of exams, and I will cover that in a different topic. So you need to understand your AKT, which is applied knowledge test. You need to understand your KFP, and you need to understand your CCE exam. So by understanding what is expected of you in each of the exams, with the AKT being a single answer exam, and obviously KFP being where you list down the things that are expected of you, and a CCE being a clinical scenario that you go through and show your various skills, and that mainly touch on the domains of general practice. So remember, this exam is geared towards general practice. They want to see if you can communicate appropriately, if you have the knowledge, if you have the knowledge, skill, and base to be able to work appropriately as a general practitioner working in Australia. So understanding that exam is very, very key. Remember, and I always tell people the answer, or what I was told, the answer is always in the STEM. So you need to understand, because remember, where else, there's some exams that I have covered in the past where, you are asked like generally, what is the best, blah, 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 blah. But in this exam, they will sort of give you a clinical scenario, which is typical of what a patient will present to you with a clinical scenario. They will give you an entire clinical scenario, and then they will ask you what is the next appropriate. So it's very important to understand those little things: best, next, what's the gold standard, and stuff like that. And again, like I said, sit back, and I should be able, I'll put through a video on this as well. So my tip number 2 is the biggest resource that I used personally was what we call GP Academy. And I was quite religious to that. It is a paid sort of preparation scenario that is done online, and the moderators or the teachers or the supervisor or whatever it is you want to call them set out, and they have a bank of questions. They run like weekly online sessions that you can listen in, and then they give you access to reading materials that you can use. I found this very helpful because, and I did try, because I was working full time. I was working 8 to 6 on most days, 8 to 5 on most days, and being an Eastern state thing, and I am in Western Australia, that meant that sometimes this would start immediately after end of my patient list. So what I did is I did organize with my practice to allow me to finish a bit early, so then I could listen in. And then remember, they would finish at 7. Our practice closes at 6. So that would be me sitting outside the clinic trying to finish this, because I knew if I don't listen in when Saul is teaching at that time, then I will not be able to listen in later. Because obviously with the nature of sort of adult learning, you have kids, you have family, you have work, and a lot of things that are overriding and screaming for your attention. I was able to I would say that Wednesday for 3 hours, I would listen in, and I would listen in because I find that important, because the main, person during my time obviously was Saul, and he would explain and give a little bit of additional tips on what to do, how to approach the exams and stuff like that. So I found that to be very, very helpful, and I cannot recommend it highly enough, because I was able to listen in, and then after that we had this bank of exams, questions that we would go through, look at the answers, look at the explanations. They will throw in the therapeutic guidelines, they would throw in some checks, they would throw in some good references that were helpful, not only for the exam, but also for my work as a general practitioner. Remember, as a doctor working in hospital, there are some things that are completely different if you're working in general practice. So I found that that was really mainstream for me. And I know a lot of people use a lot of various resources, but for me, this was my main resource that I used. And I can confidently say that it was very, very important to me and was able to help me sail through my exams. So tip number 3 is I was able to use a discussion group. So this was made up of 4 of us. And I must say this was the biggest thing for me. Having been someone like my learning way is, or my practicing way is, to study with someone. And I've done this even in my undergrad days. I was studying with a good friend of mine. And so naturally, when it comes to preparing for the GP exams, and GP Academy would encourage us to get into groups as well, I got to eventually narrow down to the 4 of us, and I must say these girls were amazing. They held me accountable. They made sure that we were grounded. We, shout out to you guys, by the way, we were able to meet up when we were supposed to. We would text each other that it's time, and if somebody's not coming on, we would call them and wake each other up. It would be almost like, you were looking forward to that time, because it became so like the norm. Like, we would end of the day, despite how tired you are, having worked from 8 to 6 o'clock, we would still meet. And sometimes I would leave work like really late at 7, and then I would get to where I was staying at 7:30, and I would have quick shower, quick dinner, and I would know at 8 o'clock we are starting our discussion. So if I did not have these girls, or if I did not have my discussion group, I would definitely get home tired, try to study on my own, probably fall asleep, or better still, watch a nice movie or something like that. But the fact that I knew these girls were waiting for me, and they also felt the same way, we would always be there for each other. We would always call one another. We would check in to see why you're not coming on board and stuff like that. And towards the end of it, the last 3 weeks before the exams, I took leave, and then it was full on. We studied back to back. I almost feel like, our lives were put on hold for a little bit, because at that point in time, we would study in the morning, we would study during the day, we would study in the evening, and sometimes we would finish as late as midnight. But look, having this trio in my life at that point in time, I believe was like the fundamental, like the foundation on how I was able to cover so much content. I was able to go through the GP Academy course, which is extensive. and I was able to do and complete that, and even keep each other sane. We did keep each other sane because we would check in on one another. We would ensure that we were going okay. And even on the day of the exam, and even after, when when the nerves are there, you're not sure if you've passed or not, we were still there for one another. And I must say, even up to date, we are kind of very good friends and checking on one another. So I cannot recommend having a discussion group enough, because one thing it's going to do is it's going to ground you, and the other thing it's going to do, it's going to keep you accountable, and it will help you achieve so much content that you would never be able to achieve on your own. I don't know, you may be having a different way of studying. I know of some friends who've studied on their own throughout, so you need to understand what type of learner you are and the responsibilities that you have. But definitely, as a working mom, as someone that's very active in the community, I was able to pass just by the virtue that I was held accountable and grounded by these girls. So my tip number 4 is, obviously, if you're on the AGPT program, which I was, there was a provision of, some resources that I found to be helpful as well. Some of them were, like the RSUGP checks, which normally I still use them up to date even as I practice. I find they are quite, detailed as well. And the beauty of, I'll go back again, the beauty of the GP Academy is they also put in a few checks that are very important for the exams, and so give you an opportunity to just cover that without thinking or going out of the course as well. So the resources are there from the RSCGP. I remember they did workshops for us to try and prepare us for the exam. They also, what else do they do? Obviously, the other important resource from the RSCGP, obviously, is using your supervisor. During my training, we had, like meetings with our supervisors and teaching as well. And just be intentional during those teaching. Don't ask about how to, especially when you're preparing for exams. It's okay as a GPT-1 to ask about how the system works and stuff like that. But I feel like once you're a GPT-2, you kind of understand that side of things. So it's about time now you gear in yourself towards the exam, because at that point in time, then during teachings, you can try and provide a teaching yourself onto a subject, like let's say hepatitis B. And then that way, the more I find, this is me, the more I teach people or I talk about something, the more I grasp that information. So use those teaching sessions to see how much knowledge you've retained. Use those sessions to teach so that you remember more when it's time for the exams and stuff like that. And just practice good clinical founded practices. Put them into your practice so that way, when the exam comes, it's just natural for you to keep going and going and going. My tip number 5, which I said earlier, is one other big tip that I cannot recommend enough, is use your patience. In GP land, I have realized you can never predict what comes through the door. You can never predict who's going to come in, and you can never predict what conditions you're going to get. So use your patience to study, especially if you don't know. Like, let's say you get a result that shows subclinical hypothyroidism, then go back and check, what's my approach to a patient coming in with subclinical hypothyroidism? Take an opportunity to look at what about the other thyroid disorders, patient coming in with Graves, patient coming in with Hashimoto's, and using that, it will help you, because when you're seeing someone, you'll be looking out for these things, you'll be asking them in the history, you will be thinking broadly about your differential diagnosis, you'll be thinking about management, and when you're talking about management, you'll ask about, supportive management, definitive management, follow-up, referrals, red flags, and all that. So very important to use your patience. I say this because one of my exams, a patient came through actually, and they were asking me about a topic that I had no idea about. And I did not completely know where I was going to refer this patient to. And I remember telling the patient, look, I'm going to look into it, and the next time you come in, we can talk about it. So see me in about 2 weeks' time, or just after I think it was around the time of exams. I will see you and we'll talk about it. But what did I do? I forgot to go and check about what the patient was asking me. And guess what? That's exactly what came in my CC. That's exactly about what came in one of the exams that I was doing. So importantly, it's very, very important to, like, when a patient comes through, to ask yourself, ask yourself, if I don't know what they want to know, it's an opportunity for you to go study, read, look through it, and discover, or learn something. Definitely learn something that is going to be helpful to you, especially if you do not know, because you just never know whether that which you do not know, that which you have never read about, is what is going to be covered in your exam. So very important to use your patients. They are your greatest resource. They are your greatest, vineyard. You need to work on them to get the answers that you so need. So make it a habit. When a patient comes through and you're preparing for exams, make it a habit and assume that's your exam case, and go through it religiously like you would do in an exam. I know it's going to take you time, but then you're building structure, you're building yourself up, and you will use that structure regardless of the question that will be put across you. You will use that structure to be able to ace your exams. Make it a practice. And my last tip that I must say is resilience. I did mention to you, this is also a very important tip that I exercise. It's resilience. Just keep doing it. Keep doing it. Keep being committed. I remember during my time, because I'm quite active in the community, but during this time, I just shut myself out to what was not, for lack of a better word, what was not essential. Okay, I know a lot of things were important to me at that point in time, but I had to shut down some of them. And I remember even during that time, I didn't put out much content on this channel. You can sort of, if you are my subscriber and if you looked at my work in the past, for about 18 months, I didn't put out much content, because at that point in time, I was just, concentrating on just this thing and saying, I need to go through this, and I need to go through it once. There are some, functions you may have to forego, some vacations you may have to forego, especially just when you're preparing for that exam. And I must say, you will still need to take breaks in between your readings, to take a walk, to take care of your family and stuff like that. But at the end of the day, come back to it. Come back to it even when you do not feel like studying. Come back to it and just keep going, because before you realize it, it's just a short period of time, a period of, being uncomfortable, but then eventually once you ace it, and you ace it once, then it's all behind you, and the rest of it is that your world is your oyster. So these are my tips of what I was able to use to ace my exams, and I must say I was able to do it in one go. It is possible. It is hard work, of course, but eventually when you pass, all that hard work sort of pays off. And from there onwards, this is it, I'm a fellow, and that's it. So if you've used different tactics as well, let's help our colleagues, guys. If you've gone through the exams, let's help our colleagues. Put in a comment down there. Tell us if there's anything you did differently. Tell us if there's any tip that you found very important amongst the tips that I've said. Any tip that you used and was helpful. If you used any different resources as well, please put it down there so that my subscribers and my fellow doctors, colleagues can be able to sit the exams and pass. And at the end of the day, a candle loses nothing by lighting another candle. So thank you and bye.